Definition of ectopic pregnancy. An ectopic pregnancy is one in which the fertilized ovum become implanted in a site other than the normal uterine cavity. Implantation of fertilized ovum in location outside of the uterus cavity, including the fallopian tube, cervix, ovary, cornular region of the uterus, and the abdominal cavity. Risk factors of ectopic pregnancy. Risk factors of ectopic pregnancy. Ectopic pregnancy. তা হচ্ছে pelvic inflammatory disease, use of IUCD, smoking, ART pregnancies, tubal damage, tubal surgery, self-injury, ischemia, nodisa, prior ectopic pregnancy, age risk of ectopic pregnancy, non-white race. Management of acute ectopic pregnancy. Management of management of acute ectopic pregnancy. Peak pregnancy. Outside management of acute rupture, ectopic pregnancy, diagnosis, clinical features, symptoms, a short period of amenorrhea, severe lacinating pain in one iliac fossa or in the hypogastrium immediately followed by profound collapse, slight sanguinous or dark colored vaginal bleeding, feeling of nausea, vomiting, and dyspnea. General, there may be anemia, fever, 2% of cases, and signs of shock. Abdomen is tense and tender, and tenderness more in lower abdomen, shifting and dullness may be elicited. তারপর হচ্ছে gut may be distended per vaginal examination usually not done due to fear of precipitating more bleeding and extreme tenderness. Vaginal mucosa blanched white, extreme tenderness on palpation of the fornix or movement of the cervix. No mass usually fell through the cervix. Pelvic examination on palpation or abdominal examination, sorry, nauzubillah, exhibits abdominal or pelvic tenderness during palpation. Tenderness in patients with EP may be generalized, located bilaterally in the lower quadrants or located unilaterally in a lower quadrants. Rebound tenderness may or may not be present. A palpable adnexal mass or mass in the cul-de-sac is reported approximately 40% of cases. Absence of a palpable mass does not rule out EP. Additional signs include shoulder pain and low-grade fever less than 10%. Pelvic examination should not be done due to tenderness. Lab investigation, TCDC, hemoglobin percentage, ESR raised blood grouping, and RH typing should be done for management. B. SCG, USG, transvaginal sonography is the choice, can be detected at ectopic pregnancy. USG can show empty uterus, cystic or solid adnexal masses, dilated and thick-walled fallopian tubes, free echogenic fluid in the pelvis, hematosalpinx and extrauterine genital. I'm sorry. যিনি বলতেছিলাম Management general হচ্ছে immediate hospitalization, 2 large bore intravenous cannulas, enduring catheter placed to monitor urine output, blood is sent for grouping and cross matching, IV fluid infusion, Hartmann's solution, blood transfusion if needed. Generally 4 to 8 bags blood should be kept ready. Analgesics, antibiotics. Send the patient to OT room as soon as possible. A specific laparoscopic laparotomy under general anesthesia after resuscitation. তারপর হচ্ছে anti D immunoglobulin in Rh negative mother within 72 hours. এরপরে আসেন ফাইব্রয়েডস 77 যে ফাইব্রয়েডস Fibroids, it is a benign tumor of myometrium composed of non-strained smooth muscle with supported fibrous tissue enclosed in a pseudocapsule. It is the commonest of all pelvic tumors, present in 20% women of reproductive age. Causes of uterine fibroids. Causes of causes of uterine fibroids. Causes of uterine fibroids. A few things can raise your chances of getting uterine fibroids, such as age race, getting your period at a young age, birth control use, vitamin D deficiency, eating too much red meat, and do not enough green vegetables, fruit or dairy, alcohol, family history. Muna P3Z4 comes to the hospital with history of 35 weeks gestation. Lower abdominal pain after pelvic examination revealed that cervix 2 centimeter dilation. As a nurse midwife, what is your diagnosis? According to question statement, as a nurse midwife, my diagnosis is preterm labor. Um, তাহলে risk factors of preterm labor. Risk factors of preterm labor. Factors of preterm labor. Term labor. তা হচ্ছে smoking, benign, very overweight or underweight before pregnancy, not getting good prenatal care, previous preterm labor or premature birth, pregnancy with twins, triplets, or other multiples, drinking alcohol or using street drugs during pregnancy, having health conditions such as high blood pressure, preeclampsia, diabetes, blood clotting disorder, or infections, stressful life events such as the death of a loved one, red blood cell deficiency anemia, particularly during early pregnancy, too much amniotic fluid, polyhydramnios, pregnancy complications such as preeclampsia, vaginal bleeding during pregnancy, presence of a fetal birth defect, being pregnant with a baby from in vitro fertilization, being pregnant with twins or other multiples, family or personal history of premature labor, getting pregnant too soon after having a baby. How will you manage this case? Management of premature labor with a premature baby. Manage a case of premature labor with a premature baby. Manage a case of case of premature premature labor with a premature baby. Mature baby. Care of a mother. তা হচ্ছে if doctor or midwife thinks pregnant women are going into premature labor, they probably need to go to the hospital. Midwife or nurse will ask about medical history, including medicines that have been taken during pregnancy, check pulse, blood pressure, and temperature, put a monitor on belly or to check baby's heart rate and contractions, swab for fetal fibronectin, which helps predict the risk of delivering early, check cervix to see if it is opening, assess fetal well-being. If you are diagnosed with premature labor, pregnant women may need treatment, which may include hydration is used to decrease the frequency of uterine contraction. Tocolytic is use of medication to stop labor. Avoid deliver prior to 34 weeks. Bed rest, IV fluids, hydration, and positioning changes. Treatment of UTI and other infection if present. Medicine to relax uterus to stop labor, medicine to speed up the development of baby's lung, antibiotics, being admitted to the hospital. pharmacologic agent medicine used according to doctor's order that are helpful to managing preterm labor includes magnesium sulfate, widely used as primary tocolytic agent because it has similarly efficacy to terbutaline, one of previous agents of choice with far better indomethacin, an appropriate first-line tocolytic for early preterm labor, less than 30 weeks or preterm labor. Associated with polyhydramnios, nifedipine, despite its unlabeled status, severely randomized studies have found nifedipine to be associated with a more frequent successful prolongation of pregnancy than other tocolytics. Glucocorticoids to accelerate fetal lung maturity. Health education raised to 2 to 3 times a day lying on the left side. Drink 2 to 3 liters water each day. Avoid smoking or caffeine. Avoid lifting objectives. Empty bladder at least 2 hours during working hours. Avoid prenatal preparation of the breast. Take prescribed prophylactic medication on time to maintain a constant blood level. Eliminate or decrease sexual activity. Monitor FHR and uterine contraction daily. Report signs of UTI. Report signs of PROM or vaginal bleeding. Care of baby. Immediate management. Cord to clamp quickly to prevent hypervolemia and development of hyperbilirubinemia. Cord length to be 10 to 12 centimeter for use if exchange transfusion is required. Adequately oxygenation to provide not exceeding 35%. The baby should be wrapped, including head in a sterile warm towel to prevent hypothermia and is sequel such as hypoxia, hypoglycemia, and metabolic acidosis. Injection of vitamin K to be given to prevent hemorrhagic problems. Intensive care, monitor body temperature at regular intervals to prevent hypothermia and hypothermia. The temperature should be maintained between 35.5 to 37.2 degrees Celsius or 96 degree Fahrenheit to 99 degree Fahrenheit. Smaller babies are to be nursed in an incubator where temperature and humidity can be regulated. Oxygen to be administered to tide over maintain desirable level of saturation. Prophylactic antibiotic therapy, the initial cyanotic phase and later to nutrition gauges feeding or parenteral nutrition depending on age and vigor of the baby. Nursing care temperature twice daily or according to institutional policy. Wait every day to know if the newborn is overhydrated or underhydrated. Continuous observation and monitoring is the first 48 hours. Visitation of mother, providing manually expressed breast milk to baby until able to suck and swallow. Observation for signs of progress such as color pink all the time, smooth and regular breathing, increasing vigor exhibited by limb movements and cry, progressive gain in weight after the first week. Teach mother about feeding to be continued, vitamin supplementation, immunization and checkup. Okay. Ah, definition of pregnancy induced hypertension. Definition of definition of pregnancy induced hypertension. Definition of pregnancy induced hypertension. It is defined as the hypertension that developed as a direct result of the gravity state for the first time in a previously normotensive patient, or gestational hypertension or pregnancy induced hypertension is the development of new hypertension in a Pregnant women after 20 weeks gestation without the presence of protein in the urine on other signs of preeclampsia, components of postpartum hemorrhage তা হচ্ছে gestational hypertension, preeclampsia, eclampsia. Okay. এরপরে আসেন কি জানি বলতে চাইছিলাম। কম্পোনেন্টস তো লিখলাম, বললাম। কম্পোনেন্টস অফ পোস্টপার্টাম হ্যামারেজ। কম্পোনেন্টস অফ পোস্টপার্টাম হ্যামারেজ। hemorrhage. Clinical feature of preeclampsia. Clinical same features of preeclampsia. Clinical features of preeclampsia. Symptoms: swelling of the foot early. Gradually, the swelling may be extended to the face, abdominal wall, vulva, and even the whole body. Alarming symptoms: headache, frontal or occipital. Disturbance of sleep, diminished urinary output less than 500 milliliter in 24 hours. Epigastric pain, blurring vision, photophobia. Signs: rise of blood pressure, persistent rise of blood pressure more than 140 by 90 millimeter of mercury is significant. Edema, visible edema over the ankles on rising from bed in the morning is pathological. Abnormal weight gain, a rapid weight gain of 2.2 kg in a month or 1 pound in a week in the latter part of the pregnancy is important. Pulmonary edema, abdominal examination reveals experience of IUGR may result from chronic placental insufficiency. লা ইলাহা ইল্লাল্লাহু মুহাম্মাদুর রাসূলুল্লাহ সাল্লাল্লাহু আলাইহি ওয়াসাল্লাম। আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। আয় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। আয় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় সফলতা দান করুন। ইউটেরাইন রাপচার। ইউটেরাইন রাপচার। Uterine rupture. A uterine rupture is a tear in the wall of the uterus, most often at the site of previous C-section incision. In a complete rupture, the tear goes through all layers of uterine wall and consequences can be dire for mother and baby. Uterine rupture is a rare childbirth complication that can occur during vaginal birth. It almost always occurs in women with uterine scars from previous cesarean section or other uterine surgeries. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم استغفر الله ربي من كل ذنب وأتوب إليه. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায়া দেন। Types of breech presentation. Types of breech presentation. Breech presentation. Types of bridge presentation: complete bridge presentation, flexed bridge. The normal attitude of full flexion is maintained. Incomplete bridge presentation, frank bridge. The things are flexed on the trunk and the legs are extended at knee joints. The presenting part consists of two buttocks and external genitalia only. Footling bridge, both the things are the legs are partially extended, bringing the legs to present at the brim. Knee presentation, thighs are extended but knees are flexed, bringing the knees down to present at the brim. Clinical varieties of bridge presentation: complicated bridge presentation, uncomplicated bridge presentation. Clinical varieties of bridge presentation. Clinical varieties of bridge presentation. Presentation. La ilaha illallah Muhammadur Rasulullah sallallahu alayhi wasallam. আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহ। হে আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হে আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় পাশ করায় দেন এবং সফলতা দান করুন। ইন্ডাকশন অফ লেবার। ইন্ডাকশন অফ লেবার। ইন্ডাকশন অফ লেবার। Induction of labor means deliberate termination of pregnancy beyond 28 weeks by any method which aims at initiation of labor and a vaginal delivery. Labor induction is the process of treatment that stimulates childbirth and delivery. Inducing labor can be accomplished with pharmacological and non-pharmacological methods. La ilaha illallah Muhammadur Rasulullah সাল্লাল্লাহু আলাইহি ওয়াসাল্লাম। আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। অগমেন্টেশন অফ লেবার। অগমেন্টেশন অফ লেবার। Augmentation of labor is the process stimulating the uterus to increase the frequency, duration, and intensity of contractions after the onset of spontaneous labor. It has commonly been used to treat delayed labor when poor uterine contraction are assessed to be the underlying cause. La ilaha illallah Muhammadur Rasulullah সাল্লাল্লাহু আলাইহি ওয়াসাল্লাম। আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় সফলতা দান করুন। মেরিটস অফ ফরসেপস ডেলিভারি। মেরিটস অফ ফরসেপস ডেলিভারি। Merits of forceps delivery. Delivery can be controlled by giving pull directly on the head and the force is to transmitted through the neck. Flexion is better maintained. Mucus can be sucked out from the mouth more effectively. La ilaha illallah Muhammadur Rasulullah sallallahu alayhi wasallam. Astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। ডিমেরিটস অফ ফোরসেপস ডেলিভারি। ডিমেরিটস অফ ফোরসেপস ডেলিভারি। Maternal: immediate injuries, cervical tear, complete perineal tear, vaginal laceration, extension of injury to involve vaginal vault, nerve injury, femoral, lumbosacral trunk, complication of episiotomy if given. Hematoma, valval hematoma, vaginal hematoma, postpartum hemorrhage, atonic or traumatic or both. Anesthetic complication following local or general anesthesia, puerperial complication, puerperial pyrexia, puerperial sepsis, urinary tract infection, remote painful perineal scars, dyspareunia, low back pain, genital prolapse, stress urinary incontinence, sphincter dysfunction, complication of episiotomy, fetal complication immediate, cephalohematoma, facial palsy, intracranial hemorrhage, asphyxia, facial bruising, skull fracture, spinal injury, a remote cerebral or spastic palsy due to residual cerebral injury, rare menstrual retardation. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah rabbi min kulli dhanbin wa atubu ilayh। আয় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। আয় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। হাইপারেমেসিস গ্রাভিডারাম। হাইপারেমেসিস গ্রাভিডারাম। Hyperemesis gravidarum is a complication of pregnancy that is characterized by severe nausea and vomiting, such that weight loss and dehydration occur, or it is a severe type of vomiting of pregnancy which has got a deleterious effect on health of the mother and or incapacitates her in day-to-day activities. Risk factors of precipitate labor. Risk factors of precipitate labor. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم আস্তাগফিরুল্লাহ রব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Risk factors of precipitate labor. Precipitous labor or rapid labor is when you give birth less than 3 hours after contractions first begin. This is much faster than average labor, which usually takes 6 to 18 hours. For mother, maternal multiparous status, small fetus, relaxed pelvic and vaginal musculature, history of rapid labors with previous deliveries, history of previous precipitate labor, delivery out of asepsis, maternal soft tissue injuries, fetal injuries from rapid expulsion at delivery. For baby is at an increased risk for breathing in meconium during a precipitous birth. Moreover, they may be more likely to face an injury such as shoulder dystocia, nodes in, nodes limb, retained placenta, hypoxia, intrauterine infection, bleeding. La ilaha illallah Muhammadur Rasulullah sallallahu alayhi wa sallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Definition of teenage pregnancy. Definition of teenage pregnancy. Pregnancy. Definition of teenage pregnancy. Teenage pregnancy, also known as adolescent pregnancy, is pregnant in females under the age of 20. A female can become pregnant from sexual intercourse after she has begun to ovulate, which can be before her first menstrual period, but usually occurs after the onset of her periods. In well-nourished females, menarche usually takes place around the age of 12 or 13. Risk of teenage pregnancy. Risk of teenage pregnancy. There are a number of risk factors for teenage pregnancy. They include family situation with regular conflict between members, violence and sexual abuse in childhood, unstable housing arrangement, poor school performance, poor school attendance, low socioeconomic background, family history of teenage pregnancies, low maternal education, low self-esteem in a relationship with an older partner, living in a rural and remote areas. Prevention and control of teenage pregnancy. Prevention and control for teenage pregnancy. Sex education, charity and humanitarian aids, provision of studying materials, adult education, law enforcement, community outreach programs, supporting efforts to prevent teenage pregnancy by providing affordable family planning services, developing clinical guidance for safe and effective use of birth control. Okay. Developing and evaluating programs in communities where teen births are highest, choose not to have sex, talk openly to partners or other trusted adults, ask how they can birth control if they choose to be sexually active, talk with a healthcare provider to learn about these types of birth control for them and use it and condoms correctly every time. এরপরে আসেন find a nearby clinic that provides birth control. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم أستغفر الله ربي من كل ذنب وأتوب إليه। আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় দেন। Caesarean section. Caesarean section. It is an operative procedure whereby the fetus or fetuses are delivered after the end of 28th week through an incision on the abdominal and uterine walls. La ilaha illallah Muhammadur Rasulullah সাল্লাল্লাহু আলাইহি ওয়াসাল্লাম আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Indication of cesarean section. Indication of cesarean section. Cesarean section. Indication of caesarean section: absolute indication, central placenta previa, contracted pelvis or cephalopelvic disproportion, pelvic mass causing obstruction, advanced ca cervix, vaginal obstruction, relative indication, cephalopelvic disproportion, previous caesarean section, previous to caesarean section, features of scar dehiscence, while primary caesarean section was due to recurrent indication, fetal distress, non-reassuring fetal heart rate, inefficient uterine contraction, small pelvis, large fetus, antepartum hemorrhage, abruptio placenta, placenta previa, malpresentation, bro presentation, bridge presentation, shoulder presentation, failed surgical induction of labor, failure to progress in labor, bad obstetric history, recurrent fetal wastage, hypertensive disorder, eclampsia, uncontrolled fit even with magnesium sulfate therapy, severe preeclampsia, medical disorder, heart disease, uncontrolled diabetes mellitus, gynecological disorders, mechanical obstruction due to benign or malignant pelvic tumor following repair of VVF. Management: manage a patient for emergency caesarean section. Management of caesarean section. Management of caesarean section. Section. তা হচ্ছে history taking, chief complaints, period of amenorrhea and any complication if present, history of antenatal checkups, obstetric history, menstrual history, history of significant medical illness, drug history, any history of drug hypersensitivity, immunization history, status of immunization against tetanus, general examination, nutrition, pulse rate, blood pressure, temperature, respiratory rate, anemia, jaundice, cyanosis, edema, dehydration, heart, lungs, breast, systemic examination, cerebrovascular, CVS, and respiratory system examination, cardiovascular system and respiratory system examination, per abdominal examination, height of the uterus, fetal movement, four grips, fundal grip, two lateral grip, pelvic grip, fetal heart rate. Investigation: blood routine examination, hemoglobin percentage, total count, DCASR, blood grouping, RS typing, RBS, uterine R routine examination for past cell protein, ultrasonography to assess fetal well-being, ECG, written informed consent, arrangement for blood transfusion, arrangement for a neonatologist, shaving of the lower abdomen and vulva, perineum and around anus, pre-anesthetic medication, diazepam at bedtime may be prescribed at last night and pure from 12 hours before operation. An intravenous cannula should be opened 2 to 3 hours before operation. Anti-ulcerant injection pantoprazole 40 milligram should be started to reduce acid secretion. Intravenous fluid, Hartmann solution, uh, preload volume of at least 500 milliliter of Hartmann solution should be infused just 15 minutes before operation in case of spinal anesthesia to prevent sudden hypotension. Prophylactic antibiotic: routine use of prophylactic antibiotic is controversial and varies from obstetrician to obstetrician, but single dose Ceftriaxone IV is recommended. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم أستغفر الله ربي من كل ذنب وأتوب إليه. Mm. Mrs. Luna delivered a healthy baby at 7 a.m. at home, and at 10 a.m. she came to the hospital with profuse pervaginal bleeding and BP low. As a nurse, according to caution statement, as a nurse, my diagnosis postpartum hemorrhage patient. কেন? Causes of postpartum hemorrhage. Causes of postpartum hemorrhage. 99 causes of postpartum hemorrhage. hemorrhage. তা হচ্ছে uterine atony, predisposing causes are grand multipara, over distension to cause, example big baby, twin, hydramnios, anemia, malnutrition, antepartum hemorrhage, prolonged labor, precipitate labor, anesthetic drug, example halothane, retained placenta, malformation uterus, mismanagement of third stage, constricted ring, uterine fibroid. এখানে precipitate labor মানে হচ্ছে মনে হয় লেট করা, precipitate labor, precipitate labor, precipitate labor. Precipitous labor is a medical term. Exceptionally rapid childbirth. It is defined as labor that is complete less than 3 hours and compress oh, from the start of regular contraction. First delivery. This is not fast delivery. Okay. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم أستغفر الله ربي من كل ذنب وأتوب إليه. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় নেন। নার্সিং ম্যানেজমেন্ট অফ পোস্টপার্টাম হ্যামারেজ। নার্সিং ম্যানেজমেন্ট নার্সিং ম্যানেজমেন্ট অফ postpartum hemorrhage. Hemorrhage. Shout for help to mobilize all staff, measures to stop the bleeding and to resuscitate it simultaneously. A quick evaluation of the patient, whether patient is hemodynamically stable or not, whether uterus is contracted or not, whether a cord is found hanging or not, to stop bleeding, injection ergometrin to ampoules, IM or IV. If IV fluid remains for sustained contraction, resuscitation of the patient, IV cannula should be inserted. Blood is sent for grouping and cross-matching. IV fluid infusion rich in oxytocin 4 ampoules in 1000 milliliter. Hartmann solution is best if it is not found DNS. Blood transfusion, antibiotics, catheterization, gentle uterine massage by left hand of uterus is flabby. Placenta is removed by controlled cord traction if placenta is not separated from manual removal of placenta under GA. if bleeding is not stopped by manual compression of uterus or aortic compression. If bleeding continues, coagulopathy must be excluded. If bleeding continues, patient is taken to the OT followed by condom catheter if normal vaginal delivery. তারপরে হলো B Lynch stitch if cesarean section. If bleeding continues, if family incomplete hysterectomy, if incomplete uterine arterial ligation, ligation of anterior division, internal life artery. If morbid addition of placenta is detected, hysterectomy is RX of choice. If fertility is very important, keep the placenta with cord in situ. Broad spectrum antibiotics, autolysis of placenta with sloughing of placenta after gentle masses of uterus. If the uterus contracted, postpartum hemorrhage is due to laceration of genital tract and then laceration should be repaired. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم أستغفر الله ربي من كل ذنب وأتوب إليه হায় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক আপনি দান করুন। হায় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। হাইডা টিডি ফর মোল। হাইডা টিডি ফর মোল। 101 টিডি ফর মোল। আসসালামু আলাইকুম। Thanks.